Hey guys, today's first episode is going to be how to stock and use a first aid kit. The first thing you always need to have in a first aid kit is a pair of gloves. Sometimes I bring 2 pairs of gloves, and no matter what you do with a first aid kit, whenever you're doing first aid on someone, you're always going to put on the gloves. Whether it's a burn, a scrape, a cut, a gunshot wound, you never know what that person might be carrying, so you're going to always put on a pair of gloves. Make sure they're good, make sure there's no holes in them. If there's holes, the blood and the fluids of the other person get into your skin, and if you have a cut, you can become infected with whatever they have. The other things you're always going to have in a first aid kit is going to be a Band-Aid, and then a moist little towel or something to clean it with. The other thing you're going to want is probably a Benadryl spray. It's used to clean out the cuts and the wounds. All you do is just spray it on the cut and it'll clean out the cut. It'll sting a little bit, but it gets it clean. 3 other things that you're always going to want to have is if someone is going into a hypoglycemic stage, which is where they have a lack of sugar, you're going to want to keep sugar, or maybe even a chocolate bar if you don't want to carry sugar, and you'll give it to them, and then that'll bring them away from the hypoglycemic side and bring them back to the normal blood sugar level. When you're in a hypoglycemic stage, it's either shock or you can go into fainting because it doesn't have enough blood. Your blood doesn't have enough sugar in it to keep your body moving. So you'll give them sugar, you put it on their tongue, you put it on ice and give it to them in their mouth. They'll snap out of it after a while. If someone does go into shock or does begin to faint, they have ammonia inhalants. All you do is you're just going to crack it like that, you're going to shake it, and then once it's red, you know it's working, and you'll let them sniff it. Once they sniff it, they'll be able to stay awake and come out of the fainted stage for 24 hours. So try not to sniff this because this stuff is not very good. When they're in a hyperglycemic stage, that means they have too much sugar. You want to lay them down, get their feet up and elevated, and you're also going to want to try to give them something that doesn't have sugar. Give them something that'll suck it up, or give them some potassium to suck up that sugar. The next thing that you're going to want to have is a sting swab. So if someone's stung by a bee, or if they're stung by a spider, or they're bitten by a spider and it hurts, all you do is you're going to crack this and you're going to bring it down to the little, it's like a little cloth pad, and it'll soak up the green, and you just put it on the sting wound like that and it'll numb it. Like that. You squeeze it, and once you're done, you can just toss it out in the garbage. Another thing that you're going to always want to have is you're always going to want a first aid kit, and the first aid kit is going to be like an ice pack. These are cold compact. All you do is you're going to squeeze it, and here for the pop, if you can get the pop, which doesn't seem to want to work. That's a no good one. Let me grab another one here. Hold on 1 second. So you're going to pop it, and after it pops, having some trouble here with it. Once it's popped, it's going to get cold. You're going to shake it because the pellets inside will meet up with the chemical inside of another little bag, and it'll make it really cold. And then this is used for nosebleeds. If someone's having a nosebleed, you put it on the bridge of their nose or the back of their neck. Or it's also used in case someone bumps their head, or if they bumped into something that they need a ice pack to make it feel a little better. So that's the ice pack. The other thing you're going to want to have is also gauze. There's little pieces of gauze, which is just regular gauze. You're just going to open it up and pull it out, and let's say they have a little scrape or something, you just put it on the scrape and keep pressure. If the blood is going through the gauze, just put more gauze on top of it, because every time you take the gauze off, you're ripping off that top layer of skin and the platelets that are in the blood right by the scrape, and it's going to continue to bleed. If it's something a little bit more major than a little cut, there's called this rolled gauze. I have one that's open here. It's basically gauze, but it's just rolled up in like a giant roll, and you're just going to roll it around their leg, kind of like this, like that, and you just keep going and going, and it'll eventually stop the bleeding. Again, if bleeding is not stopped, you can always find a pressure point. If the bleeding is in the arm, the pressure point is directly underneath the armpit, and in the area where your muscle and the bone meet up. The other pressure point that's in the leg is going to be in your groin area or behind the knee. Another pressure point is also in the artery up here by your neck if they have a facial wound, or if their nose is bleeding. For another fact for a nosebleed is if you pinch the bridge of the nose, it'll help the bleeding to stop. Let's see. The other thing you're also going to want to have is going to be a CPR shield. This is a micro shield. Basically, it's just something to keep a barrier between you and the victim's mouth. So what it's going to be like, it's going to come out in a package like this. And what you're going to do is you're going to stick this, there's a tube here, you're going to stick the tube into the victim's mouth like that. And this will be at the nose and the chin. And you pinch and turn it up, open the airway, and you breathe into that tube. And that'll give airway to the victim that's not breathing. That's CPR. That's another thing that we're going to get into sometime later. Another thing that you might also want is to have a small pair of scissors and maybe some tweezers. There's two different kinds of tweezers. There's a tweezer with a flat edge, which is great for getting out splinters, and there's a tweezer with a pointed edge for getting out glass. They both work well. I prefer the flat edge because it gets into the splinter area much better, but that's me. And then just the basic scissors in case you need to cut off their clothes, or if you need to cut a bandage off that you put on, anything like that. Another thing that you might always want to have is going to be a burn pad. So if someone burns themselves, you'll put this on. It's for first and minor second degree burns. You just put it on there, and then you take a roll gauze and you'd wrap it around, and it'll keep the gauze on there. The other thing is these are more of a burn pad, but they're a little bit larger than the little one that I just showed you, and these are clear. So what you can do is there's two sides to these. One side has like a smooth edge and the other one has like a rough bumpy edge. You're going to put the rough bumpy edge onto the scrape or the wound or the bleeding area or the burn, and it'll soothe it and it'll medicate it, so that way it'll prevent infections and it'll keep the burn from getting infected as well. Other thing you're also going to want to have is probably going to be a pack of Kleenex. If you have a bloody nose and you don't have enough gauze, you just use some Kleenex and you'll just put it on the nose, and it'll stop bleeding. You always want to keep everything organized. I have everything in little baggies. I didn't label them, but I'm definitely thinking about doing it. You know, you got the sting swabs, the sugar, the ammonia inhalant. We also have Band-Aids, and then the cleaning material to clean the cuts. And you know, everything organized makes it a lot easier to find and a lot easier to get to, so you can work on everything, you know, fast, where you're not waiting to find a Band-Aid and you're not waiting to find a gauze. The other thing that I have in my first aid kit is also going to be, it's a hospital gown, but let's say someone's bleeding very heavily, you don't want to get dirty, you don't want to, you want to keep your skin clean. You're going to pull this out. It's like a gown, it's like an apron kind of thing. You're going to tie it around the neck, and then that's about it.